Assalamu alaikum. Welcome all to Easy Human Anatomy channel. In this video, I discuss anatomy of the cerebrovascular disease part 2. Today, I mainly discuss the peculiarity of the cerebral artery and its relation to cerebrovascular disease. Did you know that a tiny blockage in a small brain artery can suddenly cause a major stroke? But here's the fascinating part. Our brain artery also have clever backup system that can sometimes save us from disaster. Today we will dive into the peculiarity of the cerebral artery, why they are prone to disease, and how their unique design can protect us in way you might not expect. Our cerebral vascular system works like a super efficient delivery network, supplying oxygen, nutrient, and clearing waste to brain high demand cells, which are incredibly sensitive to even the tiniest drop in oxygen. One small disruption and the effects can be dramatic. The most CNS artery are end artery with very limited collateral circulation, like one-way street. There's no alternate route for blood to reach that territory. With virtually no backup circulation, even a tiny blockage can starve vein tissue, trigger serious damage. Autoregulation, one of the important peculiarity of the cerebral artery. Think of cerebral autoregulation as the brain's built-in traffic control system. No matter how wildly your blood pressure rise or fall, it keeps blood flow steadily, making sure your brain never miss a bit of oxygen and nutrient. The key features of autoregulation: myogenic response. Vessels constrict when blood pressure rise and dilate when it drops to regulate flow. The metabolic regulation, high carbon dioxide or low oxygen level causes vasodilation. Low carbon dioxide causes vasoconstriction. The neurogenic factor, neural activity and neurotransmitter influence blood flow. Endothelial. It maintains cerebral blood flow by balancing vasodilation, NOPGI to EDHF, and vasoconstrictor endothelin. These factors are secreted from the endothelium and causes vasodilation or vasoconstriction. Cerebral autoregulation acts like brain safety guard, keeping blood flow steady when blood pressure is between 60 to 150 mm of mercury. Outside this range, the brain can either go to too little blood or too much. Both can be dangerous. The human brain, our most energy hungry organ, has a clever safety design. It does not rely on just one fuel line. Instead, it receives a dual blood supply. The internal carotid artery powers the anterior circulation, while the vertebral artery fuels the posterior circulation. And tying it all together is the Circle of Willis, which is situated in the interpedunculair fossa within the subdiaphragmatic space. A arterial round board that acts as a life-saving backup, ensuring the brain never run out of its vital lifeline blood. The anterior circulation, 80% of the cerebrum is get supply, and posterior circulation, 20% blood, 20% of the brain gets supply. And you see the distribution area of the anterior circulation and posterior circulation. And this is the Circle of Willis. The most of the part of the Circle of Willis is formed by the anterior circulation, and small part is formed by the posterior circulation. The distribution of the anterior versus posterior circulation explain the frequency and type of the stroke in cerebrovascular disease. Anterior circulation stroke are more common, while posterior circulation stroke affect vision, balance, and brainstem functions. Think of the cerebral artery, a precise wording of the brain's anterior, middle, and posterior cerebral artery branch out like the custom circuit, each dedicated to a specific region. This precision is a double-edged sword. If one line fails but blockage or rupture, the brain does not short out randomly. Instead, it produces a predictable pattern of the deficits, like a diagnostic fingertips revealed exactly which artery is in trouble. See, this is the anterocerebral artery supply area, the medial frontal and parietal lobe, and these are the functional area is supplied by this artery, and these are the lesions occur after blockage or hemorrhagic stroke of this particular artery. So you see, this is the anterocerebral artery. If blockage is occur, the infarct show in the medial part of the frontal lobe. This is the middle cerebral artery, and it supplies the lateral convexity of the cerebellum, cerebrum, and these are the functional area which supplied by the middle cerebral artery, and this is the functional lobes when stroke is happened in the middle cerebral artery. So you see, the middle cerebral artery is in fact is the occupies quite large area. The posterior cerebral artery mainly supply the occipital lobe and tiny portion of the temporal lobe, and this functional area is supplied by this artery, and these are the lesion. This is the occipital lobe. This is the site of infarct. Circle of Willis, where the anterior posterior circulation join, natural backup system that reroute blood to keep the brain alive while one path is failed. Peculiarity formation of the Circle of Willis. Circle of Willis is a vital arterial link at the brain base formed by the anterocerebral artery connected by anterior communicating artery, internal carotid artery, and internal carotid artery give branch middle cerebral artery, and posterior communicating artery is connect the posterior cerebral artery with the anterior circulation. It provides a backup route to keep blood flow if one pathway is blocked. So function of the Circle of Willis, balance blood pressure between two sides of the brain. Collateral flow helps keep brain blood supply if one artery is blocked, reducing stroke severity, and gradual blockage protection can prevent symptom until narrowing becomes severe. Sudden blockage limitation less helpful in sudden stroke. These are the branch point of the Circle of Willis, and this is the site of aneurysm. Branch point of the artery, the Circle of Willis, is predisposed to aneurysm because hemodynamic stress, blood flow hit branch point at high pressure, causing wall stretch. Structural weakness. This point has less smooth muscle and elastic tissue in tunica media, making them weaker. The tunica media thinning, the lack of muscular support means blood wall can bulge out and form a secular aneurysm. So these are the branch point, and this is the common site of aneurysm. The Circle of Willis present in the subarachnoid space, so hemorrhagic stroke causes bleeding in the subarachnoid space, and it is present with the sudden severe headache, meningeal irritation, and rapid rise of the intracranial pressure. So this is the subarachnoid hemorrhage. It follows the sulci of the brain. Now the histology of the cerebral blood vessel. This is extracranial artery, this is intracranial artery. In intracranial artery, the tunica intima is present but is thinner than the extracranial artery, and tunica media content thin layer and few smooth muscle cell and less elastic fiber than the extracranial blood vessel, and there is no external elastic lamina, and adventitia is much thinner than the extracranial artery. The thin tunica media, cerebral artery has fewer smooth muscle layer compared to the systemic artery, and it causes weaker wall support. Internal elastic lamina is thin, so it cannot resist high blood pressure. Absent external elastic lamina also make it less supportive blood vessels. So clinical significance, this structural peculiarity makes cerebral artery more prone to rupture, especially under conditions like the hypertension, aneurysm formation or trauma leading to intracranial hemorrhage. This is according to the location, the cerebral artery are two types, cortical artery and the perforating artery. The cortical artery is run over surface of the brain, and its tunica intima is thin, and subendothelial connective tissue also thin, internal elastic lamina present but thin, tunica media content few layer of smooth muscle cell, external elastic lamina absent, and the thin merge with pyometer and perivascular space. These are the perforating artery arise from the cortical artery, and it actually supply the white matter or deeper structure of the brain, for example basal ganglia, internal carotid, internal capsule, and the lower portions, deeper portions of the white matter. So if we consider thickness from here to here, the outer 2/3 is supplied by the cortical arteries and inner portion is supplied by the perforating artery. The tunica intima and internal elastic lamina is much thinner in perforating artery than the cortical artery. Tunica media also thinner than cortical artery, and external elastic lamina absent, and tunica adventitia is very delicate. There is a mostly end artery lacks significant collateral flow, so blockage can causes small but important lacunar stroke. Their thin wall and lack of external elastic lamina make them vulnerable to damage from the high blood pressure, which can cause microaneurysm. The number and territories of the perforators are widely vary among individuals, complicating surgery and treatment. Damage and blockage lead to neurological problems depending on the affected brain region. Important groups include lenticulostate, thalamo perforator, and the basilar perforator supply the brainstem. These vessels often originate near the branch point prone to aneurysm functions. Understanding their anatomy is crucial for neurosurgery and stroke diagnosis. So this is the anterior perforating substance, this is posterior perforating substance, and here the perforating artery is entered within the deeper portion of the brain and supply the white matter and deep brain structure like basal ganglia, internal capsule. This is the anterior perforating substance. In fact, this is the lacunar stroke. This is the posterior perforating substance infarct, thalamic syndrome or midbrain syndrome. This is vascular space are related to cerebrovascular disease. The enlarged perivascular space are often seen in the MRI in patients with hypertension, cerebral small vessel disease, lacunar infarct, and cerebral amyloid angiopathy and dementia. Impaired drainage of interstitial fluid, vast accumulation of the protein amyloid here, and vascular damage, stiffening and leakage, dilatation of the perivascular space. In short, enlarged perivascular space are considered a marker of cerebral small vessel disease and associated with stroke risk and cognitive declines. Blood-brain barrier of the cerebrum. It is formed by the endothelium, which are connected with each other by the trunk junction, and these are the continuous type of capillary. No fenestration is present. It has rest on basement membrane. It is continuous and thin. There is no gap present within the basal membrane, and pericyte is present, and also astrocyte end plate is covered most of the surface of these capillaries. Functions: maintain homeostasis of the central nervous system microenvironment, regulate entry of the ion, nutrient metabolites, prevent entry of the toxin, pathogen, large molecule, and stable neuronal activity. Relation to the cerebrovascular disease: in ischemic stroke, hypoxia or ischemia, blood-brain barrier disruption is occur, causes leakage of the plasma protein, and edema within the brain is occur. You see here the breakdown of the tight junctions. So blood enter, the toxin is out, and also the which this toxin is damage the neuron. Hemorrhagic stroke, vessels rupture, blood-brain barrier breakdown, blood component enter the brain parenchyma, neuroinflammation, and neuronal damage. Cerebral small vessel disease, chronic hypertension, diabetes, aging, gradual blood-brain barrier dysfunctions, leakage of the protein, white matter lesion, and lacunar infarct. Neurodegenerations impair blood-brain barrier clearance of the amyloid beta via perivascular drainage, deposition in the vessel's wall. Infection and inflammation of the blood-brain barrier, disruption in meningitis, encephalitis, and multiple sclerosis. Immune cell infiltrate and neuronal injury. Cerebral blood vessels have poor regenerative capacity compared to the cerebral blood vessel. The specialized endothelium, cerebral blood vessel from the blood-brain barrier. This specialization limit proliferation and repair mechanism. Very thin tunica media, fewer smooth muscle cell, no external elastic lamina, provide less structural support for repair after injury. Limited adventitia is very thin leg vasa vasorum, so deeper vessels layers depend only on luminal diffusion for nutrition, so poor healing after damage due to the lack of nutrition. And artery nature, many cerebral artery has no collateral circulation, is damaged, occlude, necrosis instead of repair is occur. Central nervous system environment, brain parenchyma lack robust inflammatory and fibroblastic response, which causes weak vessel remodeling. So negative and positive side of the cerebral blood vessel. Positive side, thin wall allow efficient exchange and rich autoregulation, maintain stable cerebral blood flow, endothelial control, fine regulation of the vascular tone. Perivascular spaces help with fluid balance and burst clearance. Negative side, thin tunica media, absent external elastic lamina, causes structurally weak. Internal elastic lamina thin, prone to aneurysm and rupture. perforating artery and artery, no collateral supply, infarct risk, susceptible to hypertensive damage, poor regeneration capacity compared to the systemic blood vessels. So this is all about the peculiarity of the cerebral artery. If you find this video helpful, please share this video, and if you feel after watching you get tiniest information or benefit from this video, please subscribe my channel, and I thank you who already support me by subscribing my channel. Thank you for watching.